Thank you and welcome to my case analysis. My name is Brianna Jasper and I will be presenting a case analysis on a patient who is 64 years old who had an issue with opioids and how that has to do with the opioid epidemic. In this case analysis, we cover, as I said, a 64-year-old patient who had chronic back pain and was prescribed opioids by his doctor. As we will discuss, this patient had many risk factors that should have been addressed before the prescription was given out. The patient eventually quit using the opioids and selling them, which is connected in with the opioid epidemic in the United States and as society as a whole, and how it contributed to this patient in this case. For background, our patient is a 62-year-old male. We will call him Greg for this case study. He, as I said, had chronic back pain, which was diagnosed as trapezius myofascial pain. This isn't connecting with the opioid epidemic just because this should have been analyzed and assessed from this patient at a closer view, and because of the current battling of the opioid epidemic and the media's portrayal of what that typically looks like was much different than what the case presents with. And I think that we as healthcare workers need to be more prepared and ready to look at the unusual and not just see them as a group. So, and typically, as the media prescribes, we see somebody who looks like this. For all of you who have seen Breaking Bad, this is Jesse. He has the rugged look, he uses guns, he's rough around the edges, and he's younger. And our patient is a 64-year-old male who had no prior abuse of using drugs or no prior abuse of abusing prescriptions and such, which kind of makes him look a little bit more like Walter White from Breaking Bad. So just kind of a funny input that I thought with this case. So a little bit more background on our patient. He had a history of abuse by his father growing up. He also abused alcohol all throughout his life. He had a gambling addiction, which increased his need to sell the drugs. He had arrest for spousal abuse against his wife. He was arrested and incarcerated, and then he was prescribed the oxycodone by his doctor, and this led him to selling drugs. And so in analyzing this patient, I noticed that it said there were intermittent urine lab draws, and that there must have been, it did not specify, but there must have been a show of normalcy throughout this. He was originally prescribed the opioids in 2006, and in 2011 is when the suspected drug selling was analyzed, and this case was pulled out. And so he only had intermittent analysis, and then the final analysis that they had showed that he had no oxycodone in his system, which leads me to believe that there must not have been just a sudden decrease, but there maybe should have been a little bit closer analysis of this throughout the years. This gentleman has a gambling addiction, which accumulated debt, and in him trying to deal with that debt, he decided to sell the prescription drugs that he was receiving. And so I'm seeing a lack of assessment by the healthcare professionals that he was entrusted with, and unsure of an underlying cause from this. So as he has continued throughout the years, he would have no appointments and just show up in specialist office requesting higher doses of oxycodone, and more often as it showed up. His wife later admitted that the patient, her husband, stopped using the drugs and was selling the drugs to cover the gambling debt. Okay, so in recommending for this patient, I recommend no more opioids. This patient was receiving bi-monthly trigger injections where he would have to show up to the hospital and receive the injection by a healthcare professional, and he could not take anything with him. And so this is something that I would recommend to continue, and maybe to rely on more than the opioids, as they must not have either been working as well or his pain has subsided into not needing them as much. So my recommendation is no more opioids, as they also have a lack of evidence for long-term use aside from cancer patients. Also, the bi-monthly trigger injections have a safer therapeutic index, as well as there's no risk of abuse as much when the healthcare professional is giving them. I also recommend some non-pharmacologic methods to dealing with the patient's pain, whether that be some acupuncture, massage or aromatherapy, physical therapy, chiropractic, as well as therapy for his past traumas in his life, by the abuse of his father, the alcohol abuse, the gambling addiction, the spousal abuse, and so on. So in conclusion, I would recommend to continue the bi-monthly trigger injections, rehab to deal with his opioid and gambling addictions, therapy and support groups to help him develop strong relationships and to rely on people so that he does not resume his life of addiction, gambling, and turn into selling drugs to cover those debts. I also would recommend a much closer and individual assessment of this patient, as they have chronic pain and they are continually receiving opioids. I think that the ceiling effect that is related with them needs to be addressed, and should be have sooner and better lab draws for the patient, so that we can better assess his vitals throughout this to see whether the pain is being correctly addressed. So thank you so much for listening. Bye-bye.